This meeting is being recorded.
Welcome, and thank you for joining us today for the meeting of the New York City Health and Hospital Capital Committee. Today's meeting is officially called to order. I would like to propose a motion to adopt the minutes of the Capital Committee meeting held on September 12, 2022. Do I have a second?
Second.
Thank you. All in favor?
Yes.
Anyone opposed? Anyone abstain? The motion is adopted. Next, we will hear from the Senior Assistant Vice President. Oh, no, we will hear from the Senior Vice President, Matt. Thank you.
Great to be with you all. Thank you. I'll read Manny Saya's remarks into the record and look forward to moving forward. But this month, the Office of Facilities Development has updates on several key initiatives. We're pleased to announce that we are partnering with the ACE Mentorship Program, a free award-winning after-school program designed to attract high school students into pursuing careers in architecture, construction, and engineering, including skilled trades. Beginning in November, we'll host high school students at NYC Health and Hospitals Metropolitan to introduce them to the career pathways within these fields and within our healthcare organization. In a first-of-its-kind partnership for the ACE program, hospital staff will partner with vendors to provide instruction to the students on how to prepare project budgets, compile design specifications and drawings, prepare bid packages, and the elements of managing a construction project. As public health preparedness has become more prominent, we are very excited to prepare the next generation of architects, engineers, and construction managers to support our healthcare system. After intense preparation at Metropolitan, we've successfully completed surveys for the Joint Commission at Metropolitan. We've also completed a survey at Harlem. There were no major findings, and the surveyors were very complimentary of the leadership, staff, and quality of care provided at the facilities. Metropolitan was very responsive and quickly addressed any findings during the survey. We look forward to applying lessons learned to prepare Elmhurst for their upcoming Joint Commission survey. Next update, we're actively in the process of compiling all our facility new needs in preparation for the January financial plan. Facilities have submitted their new needs on September 29th, and our teams are scrubbing and validating the data in preparation for a system-wide leadership review meeting and facility-specific meetings to finalize the system's new needs list. In line with our ongoing work to ensure efforts across the system are strategically aligned, the process will incorporate review by operations, clinical, financial leaders to ensure the projects approved are in line with our system's overall strategy. In our ongoing implementation of the Kahua project management software to better track all aspects of our capital project work, we recently went live with phase 1 for capturing new needs, and we're on track to complete phase 2 of the implementation, which currently includes all cost applications. And this will be a very important piece of software to help us organize our capital budget. We have 2 resolutions to present to the committee today, one for license agreements and the other to enter into contract with a vendor for design services. I'm happy to answer any questions from the committee members, and thank you as always for your time today.
Thank you, Matt. Sally?
I know we're going into new needs on capital projects. I have trouble remembering, it's been a while now, the pipeline of existing capital projects. I don't know how far we got into seeing what the capital projects were and where they were, like on a 10-year timeline, I think it was gonna be. So it'd be interesting to get updated on that. And I also assume that it's the case that no new needs projects would be taking the place of any of the existing capital projects. Is there a chance that one could get displaced because it's not moving or, yeah, so those are my two questions.
Okay. Yeah. So there's so we have the obviously the new needs and we have the current active funded portfolio. We have roughly about 350 projects that are moving forward. There's still a lump sum amount that has not been allocated, and there are unfortunately situations where we get caught in emergencies where we have to actually take some of that funding that was previously allocated towards another project and fund our emergencies. So we are tracking a separate ledger for those and requesting a replenishment of the new needs for those particular projects. The new needs exercise is separate. It's above and beyond of everything that's not funded. And we are looking at the overall 10-year plan, whether it's for infrastructure or for clinical new needs. So,
Because
it'll
we
be
had talked at a point about like having, like by areas, some sense of whether there were specific priorities like whatever, replacing all x-ray machines or whether one, those more generic that cut across hospitals, and then two, just getting a sense, and maybe we got this already, I just have lost track of it, whether we had by hospital, even in, we don't need every delineation of 350 projects, but some sense of what the allocation has been and kind of the largest categories by hospital.
yeah, we can do a preliminary categorization, either by type, whether it's equipment or infrastructure, by where the project is by phase, whether it's pre-design, design, construction, or closeout. And we could do by facility as well. So we do have the capability today. It's not as advanced as it will be once Kahua is live.
Right.
But we can definitely get you something if you
Okay,
wish.
that would be helpful, thank you.
No problem.
Sorry.
Yes, Frida?
That was actually similar to the question I had, because reading the new needs discussion for the January plan, we have like a master plan, right? That's what you're talking
Yeah,
about.
the
So
master
it's
plan.
10-year master, and so these are prioritizing for this year the projects that are in that master plan and maybe a few additional new things that the facilities have identified. Is that kind of what I'm hearing?
A lot more additional
more.
new needs, yes.
Okay.
We do have some master planning efforts already underway. For
Uh-huh.
example, Elmhurst and Lincoln have done some master planning exercises. We are trying to initiate Jacoby and Kings for additional master planning. We're in the process of we're still in the RFP mode
Right.
or phase to bring on the master planning consultants. But it's not going to be overnight.
Yeah.
Some of these master planning exercises do take about a year and a half, 2 years,
Right.
depending on the facility. But there are some known unknowns that we have today, right? We have failing infrastructure throughout our system, so there's things that we definitely know. I think the master planning is more so for
Longer term.
longer term or clinical type of changes that we want to make. Maybe we want to relocate the ED from one area to another,
Right.
or the executive suite from one area to another. So that's where we really need our consultants to help us bridge the gap when it comes to the flow, the operations, the business. Will it make sense? Putting together a massing exercise is not easy. But right now the new needs is definitely needs that we have, or even some pies in the sky type stuff. But hopefully the master plan exercise will give us a better insight of what we need throughout the facilities.
So is the cycle you typically that around now we would be preparing for the January financial plan to prioritize what projects we want to get funding from the city, right?
Yep.
That's the
Yep.
exercise, and so that will kind of escalate for emergency or high priority things
Yeah,
as we're operating. But we have a longer term planning horizon where we're trying to put everything together, and we can identify other potential. I sort of think of it like triage, and
Yeah, we have priorities. We have critical needs. We have things that we know we want to do, and then and then kind of map it all out after, for 10 years. So to give you an example, elevators. We know that our elevators need to be modernized. We can't modernize them all today. Even if we were to get all the funding today, we still have to map them out and spread them out. So maybe our elevators are still they're still within the useful life. They still operate, but maybe 8 years from now, 9 years from now, we can change some elevators at some of the locations.
Right.
Just to give you one example.
Yeah, and some of this is going to be driven by capital resources, right, or funding resources. So this is city capital.
Yes.
This is city capital. I think the improvement in the process that we're trying to make this year, which is we try to make modest improvements all the time, is we want this list to be really the document that we're working off of around the system for every level of funding request.
Okay.
Right. So the city budget should be our base. That's our January plan. But thankfully, we have support at the state level, at the federal level, there are earmark and other funding opportunities.
Right.
But getting everybody working off of the same list of things kind of biannually so that we have a standard set of projects that we can execute on quickly whenever funding comes available from any level of government or supporter
Right.
is critical. So we're getting ourselves, all our teams kind of aligned on this schedule to keep this same capital budgeting flow throughout the year. It sounds like a little thing, but there's
No, I
there's
think
so
it's
many
a very
different-
big thing. I mean, that's the challenge is, because you're juggling capacity to execute the projects, funding, how do you get funding, and also trying to operate the system and make sure things are happening, but then thinking forward of how can we do that? Because it's hard to think about how can we get more funding if we don't know what the picture is, right? So it's
Yeah.
try to
I think
do
our,
it.
you know, our needs are so great, there's no shortage of things to ask for.
Right.
And the thing we've worked on, I think, talked about the most is how are you balancing what's a next 5 to 10 year need versus really planning for the 20, 30, 40 year horizon, right? And the master planning exercise, I think, is really that exercise. Where are we building whole new towers? Where do we need to fundamentally rethink the footprint and infrastructure of a facility?
Right.
And
But
there's a lot of.
But trying to secure additional dollars, for example, it's helpful to have the picture of what are those
Absolutely.
horizons so that we can try to escalate, and need to get more people to do that. But yeah, that's a second tier problem, right? Okay, thank you.
Thank you. Any question?
I'm sorry, just last question. We get funding from elected officials, and it goes into things that generally the elected official is interested in, and of course, no one's going to turn away money, so the hospital would be interested in. And I'm just wondering how you balance that when you have whatever it is, $200 million going to Elmhurst, 100 million going to Metropolitan, which we might not have opted, for example, or we might, I don't know, to put into Metropolitan. I don't know if there's a way of, and maybe we try with elected officials to steer them to the things that we view as priority items. But we see really large amounts of money going in, and I'm not sure how neatly they fit into our priorities.
It's a very delicate balance. I think you're right. There's 2 levels of it, I think. The first is just this basic step we're taking of making sure we have kind of system strategic alignment around whatever is kind of on the menu for our elected officials. Right? If people are interested in something totally unique that we haven't thought of, that's okay. We can work with it. But generally, we'd like to be in alignment about if an elected official is interested in something, here is a menu of 5 to 10 things that need to happen at this facility. So that keeps it a little bit more organized and make these things executable, right? But the next point that you raise, I think we try to balance. There are some facilities who have elected officials who are much more active and have put much more money in. I think balancing that with just central city OMB capital that comes to the system is certainly something we try to keep in mind, because you don't want some hospitals with brand new infrastructure and some that are failing to get investment. So it's a challenging balance.
And Fenny had asked a question. Do you remember, Fenny, that you thought that we should have like an innovations fund, or where we had some money set aside where we could award to hospitals that came up with particularly creative ideas about things we could do? You remember that?
Yeah, and that's referring to sometimes we are so much embedded on our current needs, because there is fires everywhere, things that needs to be attended to, leaking roof, HVAC not working. That sometimes you focus too much on the needs to run your hospital, but sometimes you don't have time to think of what may look like if you were to do something different. So I have seen in some agencies that they allow that kind of potential looking at the future and think innovative and propose and then go through a selection process. This is something that we are going to fund. It's not a need,
Right.
but it will reimagine your space to serve the function that you would like to do.
Right.
Yeah.
I think that's a great idea, and I think that the master planning process, we hope, is what kind of gives us the, fertile soil for those ideas to come forward, right? And so facilities that invest more of their time and think more creatively through that process will have, I'd say, very built-out ideas of more fundamental changes, longer range investments to make. But the idea of an innovation fund and a kind of quasi competitive selection process is an interesting one. I think we'd like to get probably more of that, thinking around the master planning out there so that people have had a little bit of kind of forced time to invest their team's time to align their own facility strategic priorities around it and build out, a series of projects that then they could put forward for such a innovation fund.
And then they can look at to their specific population and communities and where the demographics is changing and look at that. I think what you heard, and I just want to make the comment, we have discussed several times in the past 2 years that I think the board would like to know a little bit more about the capital budgeting process. And I think this is a question that you're hearing from Frida and from Sally. And we had discussed in the past to look at an educational session in which you can walk us through and share with us. I know that we postponed it because you have other priorities, COVID, one of them. So, but I don't know if there will be a good time now for you to come into educational session and share with us kind of that prioritization, how hospitals submit the projects for consideration, how do you steer the funding allocation and the funding raising. So I think maybe that's something that Coalition we can do. I know that we have postponed it, but I think maybe this type of question can bring that back to the Ford Center.
Absolutely. Yep. And I think we're happy to do it. And it shouldn't wait for our project management software to be in place, right? We have all these things not in, the toolbox that we would like yet, but we can present all that and walk you through it and welcome your feedback and advice on how to improve it.
Thank you, Matt. I know that we are a little bit tight for time, so we have two resolutions. Again, thank you for your report. The first one is T-Mobile Northeast LLC and Metro PCS Wireless Inc. And this is going to be presented, I don't know.
By me as well.
Okay.
I'm Manny and I'm Leora today. So
Okay. I didn't want to mention Leora's name.
you guys are really getting
And
the
telecommunications.
short end of the stick today. Our resolution today is authorizing the New York City Health and Hospitals Corporation, the system, to execute 5-year revocable license agreements with each of Metro PCS Wireless Inc., Metro PCS, and with T-Mobile Northeast LLC, T-Mobile, to operate cellular communication systems on approximately 200 square feet of space on the roof of the A building and 200 square feet of space on the roof of the AC building, respectively, on the campus of NYC Health and Hospitals Kohler Rehabilitation Nursing Care Facility, the facility, at an annual occupancy fees for each of $74,500, calculated at $372.50 per square foot, to be escalated by 3% per year for a 5-year total for both sites of $791,061. So the background on this resolution: Kohler has had communications equipment on campus since 2009. The equipment is part of a cellular communications network with the antenna serving different radius. The equipment really has very little impact and does not compromise facility operations at all. It complies with all federal statutes and other things about cell towers. In 2017, the board authorized 2 5-year license agreements with T-Mobile and Metro PCS. The existing agreements expire on September 30th and December 31st, and we are proposing to extend them both and to make them coterminous. Next slide. They'll continue to operate 200 square feet on each building. We went through the occupancy fees, but it is $372.50 per square foot, and that'll escalate by 3% per year. The new agreement, with your hopeful approval, will commence on December 1st. There are unique site-specific factors that affect the price and other things for rooftop space, and they differ from typical commercial lease spaces. But the fair market analysis is a little challenging. But this is the next slide lays out the breakdown of how We have escalated the revenue we'll generate from these, increasing from 61,800 to 74,000 in one case, and from 63,600 to 74,500 in the other case. And that is our approach. The reason they were formerly two different companies, but they have come together, and so we have tried to make them coterminous, but they are keeping separate business units within T-Mobile. So we are executing the leases like this, but it is one entity, and we will keep it organized on the same time schedule with your approval.
Thank you. Question, Frida?
Do you have, I mean, it's not a lot of money, but I just wonder, how did the original transaction occur? Did they approach us, or are there opportunities for us to be doing this all over? I mean, we have a lot of real estate.
There are opportunities. I think I have not been approached about a new one recently in my 6 months or so working more closely with this team, but I think they are not always the most welcomed things by communities at new sites, but these have been unobtrusive, very effective, and helpful. So we propose to continue them. It's not something we seek out or kind of market to the industry. I'm sure we could do more.
Right.
But as you said, I think for this amount of money, it hasn't been a major area to invest our focus in, kind of seeking out new business like
Do
this.
we have to do anything to prepare the site for them, or maintain it, or anything that, like?
I think protecting access and just kind of general.
It doesn't cost us anything.
No, not that we can isolate. No.
Great. Thank you.
Thank you. Any other questions? I just want to make a quick comment that, first of all, I wanted to thank the team for your approach to real estate leasing. I think you're really bringing a more standardized process and a longer term, so that there is some kind of good understanding of the rules. And in this particular one, I know that you try to synchronize these two. They were like two separate timing. One of them actually expired already, but I think they're going month to month, while the other one expired in December. So now you're going to make a codependent kind of the same timing. I know that you also try to make it one lease, because these two are the same company, but the two companies wanted to have separate, maybe because of their accounting system. But I just want to say that we have seen how the leasing agreement that have come to the board really looks at ensuring that our interests are at the front and center, and trying to make the best of this arrangement. So I just want to thank the team, and particularly Laura, for what she has doing. And this is a good example of one that tried to standardize these leasing agreements. Okay.
Well, thank you so much. I'll pass that along to her. She'll be very grateful. And yes, we really appreciate your guidance on it all, and glad we're making progress.
Thank you. So now I would like to ask now that there is no more discussion, is that correct? I would like to ask for a motion to. Okay. I would like to take a voice vote. All in favor?
Yes.
Yes.
Anyone oppose? Anyone abstain? Hearing that, the motion is carried. So now I will recuse myself. Chairman Pagan will continue the meeting. Thank you.
Thank you. So let's move to the next resolution. Want to read it into the record?
Yes, good morning. The resolution authorizing New York City Health and Hospitals Corporation, the system, to execute an agreement with STV Incorporated, STV, to design the flood mitigation system to be constructed at New York City Health and Hospitals Kohler Rehabilitation and Nursing Facility, also known as Kohler, for a cost not to exceed $7,930,000, inclusive of a 20% contingency of $1,320,604 contingency over a term to be coextensive with the duration of the project, which is estimated to be 8 years. With me is my senior director, Aniqua Brown, who leads the FEMA program for the system at the 4 locations, specifically for this particular resolution at Kohler. So she will present.
Thank you, Oscar. So Kohler is unfortunately located in a 100-year floodplain as identified by FEMA. And so during immediately after Hurricane Sandy, they were left without electricity, heat, or hot water. Since then, with funding from FEMA, we have been able to implement multiple repairs, enhancements, and mitigation solutions that have significantly improved the safety and resiliency of the facility. With that, our largest FEMA program or mitigation program is in fact this exterior flood wall project, which is designed to protect the facility at a 500-year flood level. We have $98 million allocated from this project, of which $1.8 billion have been FEMA grant for our entire portfolio. In terms of our procurement schedule, this has been sort of a fast track where we started with an RFP that was issued in early July. We had on-site walkthroughs with various consultants just a week later on the 19th. We had a pre-proposal conference where we talked to all of the vendors. They were able to ask questions just that following week, and late July, followed with proposals were due at the end of August. By mid or early September, we had presentations from 4 of the different vendors that had submitted proposals. Just a week later, the evaluation committee evaluated those various proposals, and we scored the proposals by mid-September. So within a 2-month period, we had various presentations, proposals, and then identified a selected candidate. In terms of criteria for the RFP, we were looking for a vendor that had at least 5 years experience in designing particularly a flood mitigation program, and also had experience with construction administration. That vendor or consultant had to be a licensed professional with a New York State license, and also had to meet our 30% MWBE goal. In terms of the substantive criteria, 25% of their proposal was based on the quality of and experience of their firm. 25% was based on the qualifications of their staff. 20% on their approach and how they were going to actually try to implement this program for us. 15% was based on MWBE, and finally 15% of the overall proposal was based on cost. In terms of our evaluation committee, we had 5 people as part of the team that evaluated the various proposals. 3 of those people came from our OFD office. We had a person that represented fiscal affairs, and then of course we had someone from Kohler representing their interests as well. In terms of the project itself, again, we're looking to enter into a contract for design services. The funding for this project will be out of our FEMA grant, and our budget breakdown consists of about $6.6 million for the design, $1.3 million for contingency, totaling a overall budget value of $7,930,000. Our schedule will hoping to span over the next 8 years, beginning within the next month or 2, hopefully fall 2022. And we're asking for the contract to expire upon the completion of the project. We don't anticipate any major impact to the facility during this operation, so they should be able to maintain their operation throughout this project. In terms of STV's performance, in their proposal that they provided, they identified more than 65 projects that they worked on regarding Sandy, which is great. They were awarded the 2nd largest FEMA award for public assistance, alternative procedures affiliated with the Sandy-related projects. STV to date hasn't had any direct contracts with H&H, but we have certainly worked with them as sub-consultants with other vendors that we've partnered with. And STV has also worked with other public agencies. With the research that we've done in evaluating their previous experience and evaluations via mocks, we found that the majority of the evaluations had positive feedback. 2 of them had a poor rating, in which we evaluated further and found that one of those ratings were in 2003 and the other in 2020. We were able to connect with the poor rating from DEP and found that they, in fact, have improved once they received that negative rating and understood the issues. They are still working with DEP, and they have informed us that they have significantly improved their service. So that was great to hear. In terms of MWBE utilization, STV is actually planning to exceed our requirement. We have proposed a 32% requirement, and they're actually going to exceed that to 34%, totaling a value of up to $2,247,000, which is great.
And this last slide is just the resolutions. We'll take any questions.
Thank you. Any questions from committee members? Frida, and then
Thank you. Thank you. Thank you for following up on the poor ratings, because you answered exactly my questions, and if you talk to DEP. But also on the fee construct, because this is only design services, right?
Correct. And construction administration.
So that's like overseeing the construction? Or
No,
what does
so
that mean?
construction administration would include, they'll be our design partners on a project, so they'll continue to evaluate the design, address any infill conditions and changes, that affects the design.
So that's why, because I wouldn't have normally expected a 20% contingency for design services, but because this is an 8-year project, flood, is that what, that there's unknowns, they might need to do a lot more?
That is correct. And so we're also dealing with external regulatory agencies that we typically don't deal with on a normal basis, including FEMA. There's an approval process that takes place, and there's a few back and forth that's required. And so understanding those regulations, and again, over the next 8 years, any guidelines and situations can change. And so to be able to accommodate those adjustments.
Got it.
And in addition to that, we also we have to coordinate with REOC, Roosevelt Island Operation Corporation. REOC. The REOC is Roosevelt Island Operations.
Oh, got it. Okay.
So they're going to have probably certain requirements that they want out of the berm wall that the designer may not necessarily consider, but we may have to incorporate at a later time. So
there's more unknowns.
That's right.
They might need to do more work and dig in. Okay. Thank you very much.
Yeah, I just got a little bit confused about, they have $98 million out of all of our FEMA funding. This is just the design. So has some of the 98 million been used? Is there more, will the work that needs to be done, the construction work, be done after during these 8 years?
Yes.
Oh,
so
okay.
we can go back to, there's a slide. 6 on this sheet. Next slide, maybe. Yes, on this one. So we have 2 years of design, 1 year that we're anticipating for procurement, and that's procurement of the construction contract. So we anticipate it's going to take about a year to actually get a contractor on board. 3 years is the actual what we're anticipating for construction. So we're anticipating 3 years of actual construction, and then 2 years to close out. There's a lot of paperwork and administrative requirements as it relates to FEMA to close out a project of this magnitude.
So you'll have a construction contract coming back?
Yes.
Okay, thank you.
You're welcome.
okay. Any other questions or?
Sorry, I did have one other. I think there were 26 or somebody proposers who attended, and you've only received 4. Were you surprised by that, or is there not a lot of people who have the expertise necessary for this kind of a project?
Yeah, so exactly. The 26 will probably consist of sub-consultants as well. There are a very minimal amount of people that have this level of experience to work with FEMA and flood walls and berm systems.
Got it. Okay, thank you.
You're welcome.
So having 4 was probably a good result.
Yeah,
it
was a good turnaround in our case. We were happy to have that many to be able to that were interested and be able to submit their proposals.
That's good to hear. Thank you.
Great. Let me then ask for a vote on the resolution. All in favor, please say yes.
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 Opposed, say no. So the resolution carries. Thank you so much for your time. And is there any old business or new business to come before the committee? Hearing none, the meeting is adjourned. Thank you so much.
Thank you.
Thank you. 11 minutes.
Thank you.
Good job.
Thank
This meeting is no longer being recorded.